Hello, I'm Mark Skinner. I was president of the World Federation of Hemophilia from 2004 to 2012. The Global Alliance for Progress project, a decade-long development program, was well grounded in concrete and measurable goals. It was an ambitious program to propel forward dramatically the care in 20 developing countries and to diagnose 50,000 new individuals with hemophilia globally within the decade. When I became president of the WFH in 2004, the GAP program had just recently been launched, but the WFH development model was well established and well defined, containing 5 essential integrated and interrelated elements. More recently, a 6th element related to data collection and outcomes research has been added to the model. In 2005, I had the opportunity to visit Thailand, one of the first and early GAP development countries. We were doing an outreach about 3 hours outside of Bangkok, northeast of Bangkok, into a small rural area. And we came to this regional hospital where we were looking at development models. And we had the opportunity to meet this young boy and his mother. The young child was just really learning to walk, and he had fallen and severely bruised his bum. It was the first time that hemophilia had actually presented in the family, and they didn't know what the condition was. So we met him in this large, open ward hospital with no windows, with limited care, and a family that had really basically no access to treatment and limited patient support. And it really is moments like these and learnings that you realize the magic of the GAP program, that it's designed to develop a truly national program that isn't just about establishing one treatment center in a capital city, but it's about building an integrated national sustainable care model from the local to the regional and the national level. Over the course of the first decade of the GAP program, we've achieved our goals. Over 60,000 individuals were diagnosed with less than 10 years of data reported. And I'm also pleased to report that 16 countries have now established national hemophilia programs so far within the GAP program, including Thailand that I just mentioned. Patients and national organizations are a key part of the winning coalition that makes all of this possible. Along with doctors, healthcare professionals, and the government officials, patients really are the ones that have the most to lose or to gain through the success of this work. So starting in the 1990s, the WFH began developing workshops to help patient leaders develop their skills and training so that they could be effective advocates. This has grown into a truly global national advocacy action program that was launched in 2006. And through these workshops and trainings, over 1,000 patient organization leaders have now been trained to make their case before government. When the WFH first began meeting with governments, they asked the obvious and reasonable questions. How many patients with hemophilia are there? What's it going to cost to treat them? What are their complications? What are their needs? So in 1998, the WFH developed a survey to begin to collect data on a global level throughout the world. And for 13 years, the WFH Global Survey has been collecting basic demographic data about care systems, about treatment products, and about complications such as hepatitis and HIV. This WFH tool has evolved into being a highly valued global resource, the most comprehensive data set that is now used by governments as a health planning and policy tool worldwide. In 2005, soon after I took over as president, we launched a new strategic planning process. And as a part of this process, the WFH adopted the new vision, Treatment for All, upon which our global development strategy is now based. This means that one day we envision that all patients with bleeding disorders, regardless of where they are in the world, will have access to care. This includes care by a multidisciplinary comprehensive care team. It also means that we are expanding our services beyond hemophilia to include all of those with inherited bleeding disorders, von Willebrand disease, the rare factor deficiencies, and the inherited platelet disorders. And of course, access to safe and effective treatment products. To improve proper diagnosis and management, The WFH conducts workshops at the local, national, regional, and global levels. Workshops for nurses, physiotherapists, laboratory technicians, psychologists, and social workers. The WFH has now published over 300 educational resources, training guides, and programs, many in multiple languages. And we also organize the world's largest medical and scientific patient meeting in the world. Since the HIV epidemic, the WFH has worked closely and monitored product safety and supply. The Global Forum on Safety and Supply was initiated in 2000, and it brings together all stakeholders in one setting and helps to ensure that the WFH stays as a thought leader and at the forefront of policy development and debate impacting the treatments upon which we rely. We work closely with government agencies, with industry, with clinicians, and patient groups to achieve both the quantity as well as the desired quality of treatment products. And according to the WFH Global Survey data, access to treatment has steadily increased since the WFH first began collecting data on clotting factor concentrates worldwide. Over the last 50 years, diagnosis and care for people with hemophilia has evolved greatly. But unfortunately for other bleeding disorders, the recognition and the level of care has not developed at the same rate. To address this need, as part of our expanded vision of treatment for all, the WFH has developed a von Willebrand outreach model suitable for developing countries and has produced a range of resources in multiple languages to support this effort. Over 50 years, the WFH has continued to grow and to evolve. And today we reach every corner of the globe. From 12 countries in 1963 to 122 in 2012, now covering over 95% of the world's population. As evidenced here, over the last 50 years, the work of the World Federation of Hemophilia has been a catalyst for enormous advances in the treatment and care of bleeding disorders. The WFH has played a critical role in bringing together individuals in many parts of the world, and we are now well positioned to continue our quest for treatment for all. We clearly recognize that our work is not done, that gaps in care still exist, and treatment for all is not yet a reality. But working together, we will continue our journey. And you really don't have to journey far to realize how great the need is. On a gap visit to Peru in 2008, I met this young boy. I came into the room, he ran up to me, he sat down on my lap, and we became best buddies for the rest of the day. I met his older brother and a cousin that had hemophilia in the family. And it's moments like that that you realize that the work of the World Federation is really about changing lives. And not just for this young boy, for the day that we were there, but for all the generations to come. Building those sustainable national care models that will really change the future for so many. The only way we're able to do this is because of all the volunteers that freely give of their time, their knowledge, and expertise. And if it wasn't for a caring and committed, dedicated staff in Montreal and the efforts of the professionals from governments, clinicians, patient leaders, and so many others, we wouldn't be able to achieve what we've done. The volunteers of the WFH are the most precious resource that we have. And on behalf of the WFH, a heartfelt thank you to all of you for your support and efforts.